Roya Kelashadi and Azizi Solomon state that the World Health Organization experts have estimated that there are 43 million overweight children under the age of 5, and by 2020, more than 60% of global disease burden will be the result of obesity-related disorders.
Tell me a little bit about what you did in your job.
I was an x-ray tech. I x-rayed lots and lots of patients. When I was in high school, I got an opportunity to apply to the radiology program that they had in Owensboro at the hospital. And so I went and interviewed and was accepted because I knew that college was not an option. There really weren't student loans to deal with back then. I just knew that that was something that I could do and it would be a good profession for me.
Debbie Phillips worked as an X-ray tech for over 40 years. She retired with plenty of experiences in dealing with obesity.
Did you ever deal with obesity with your job?
Every day. If we thought somebody was close to the 500-pound range, we would ask the patient how much they weighed. If we put them on the x-ray table, it could break it. So we had to be very careful with that. There are some machines, like at the hospital, that would have a higher weight limit that could take care of these patients. As an x-ray tech, we had a really difficult job in positioning these patients.
Obesity is an epidemic that affects not only the obese but those around them. Because of that, many programs have been created and tested in an attempt to stop the spread.
Do you know of any measures that are being taken right now to prevent obesity here in Owensboro?
The hospital's always doing some type of programs, especially like at the health park, and there's dietitians everywhere. A lot of doctors deal with it. They'll give patients certain medicines to try to help them lose weight.
Not only does obesity cause health issues such as cardiovascular disease, hypertension, type 2 diabetes, fatty liver disease, orthopedic problems, and even low self-esteem, but it affects the quality of x-rays taken. This creates a risk where a complication has a chance of being missed.
You take somebody that's slim and trim, and then you get an obese patient, and the quality of the images is, there's a huge difference. The images were diagnostic, but they just weren't as sharp as for a smaller person.
Obesity affects others in unforeseen circumstances. For example, an obese patient can hold up a line in a hospital, risking the health of other patients.
If you go get a patient and there's a really slim person, and then you saw this person in a wheelchair, that they were in that wheelchair because they couldn't walk because they were so obese. It's going to take you longer to x-ray the obese person compared to the normal sized person.
About how much longer usually? Like hours or minutes?
Oh, it'd be double. Like if an exam took 30 minutes, you could spend an hour on that person. Okay. But I think there's a lot of people trying, but it has to come from within.